Doctors have a very important role in developing communications through the entire hospital. Doctors they need to communicate with nurses and the patients and sometimes even other doctors. So that is why I believe that public speaking and communications studies matter in the lives of radiologist doctors. Doctors have to communicate with there needs to be communication throughout the entire hospital, so that's with doctors, nurses, and other staff. When a doctor communicates with a nurse, they need to inform the nurse on what they need to do and how they need to care for their patient. And another example of a staff is a radiology tech. My mom is a radiologist tech, and so she needs to communicate with the radiologist because the radiologist needs to tell her what part of the body that there needs to be x-rays on and how she needs to do that. So that is very important. The most important thing that doctors need to communicate with is the patient. The patient needs to know what is going on and how they can help themselves, or just they need to know what is going on. So according to ncbi.nlm.nih.gov, that's quite a name, on an article entitled Benefits of Effective Communication, which was written in spring of 2010. The three main goals of communication through the doctor and the patient is the first one is they have to have a good interpersonal relationship. The second thing is faculty exchange of information. So in other words, the patient needs to be they need to be able to understand what the doctor is saying. And there needs to be patient decision making. So the patient needs to know that they have control over what decisions are being made, and they are able to make those decisions. Okay, the third point is that doctors need to communicate with other doctors. Sometimes that doesn't really happen too much because they usually control themselves, but if they need to talk to a specialist. Like for my own personal experience, I've been diagnosed with partial complex seizures, so that is another way of saying that I have seizures. And so my doctor that I go to isn't specialized in seizures, so he has to recommend me to another doctor that is specialized in it. So, and that is completely through the doctors. They have to recommend you. So he needs to talk with another doctor and make sure that the doctor knows what is going on and what has been done and possibly what needs to be done. So when a doctor communicates with another doctor, they need to, of course, sound intelligent and professional. Because if you have a doctor talking to another doctor and they don't sound professional, then they're not going to take them seriously, it's not going to look good to others if a doctor isn't professional. And the most important thing is the other doctor needs to be completely informed on what is going on and what they need to do, or what can be done. So, communication is very important in the profession of radiology because radiologists need to be able to communicate with everybody throughout the hospital, and they need to communicate with other doctors, and most importantly, they need to communicate with the patients. So that is why I believe that public speaking and communications matter in the lives of radiologists.